Hi, I feel really weak and my hands are shaking. What can I do?
Hi there, I'm Luna, the pharmacist. Please, have a seat in our counseling area. Can I get your name and age, please?
Sure, my name is Eric Robert and I'm 55 years old.
Thanks, Eric. Now, can you tell me a bit more about what you're experiencing? What happened?
Well, around noon, I suddenly started feeling weak and shaky. I noticed I was sweating a little and my heart was racing. I checked my blood sugar and it was 4 millimoles. I'm diabetic, so I took some sugar cane and some candies, but it still didn't help. My doctor said to take sugary food if my blood sugar gets low.
I'm really sorry to hear that, Eric. Is this the first time this has happened to you?
Yeah, it is.
I see here in your profile that you started taking glucobate 50 milligrams just a week ago. Can you tell me why your doctor prescribed that for you?
It was because my blood sugar was high, and honestly, I've been struggling to stick to my diet.
I understand. Do you usually take it with a meal?
Yeah, I usually take glucobay right before my meals, but today I was in a rush to get to work, so I took it without any food.
That makes sense. And do you experience any side effects from the medication?
Well, I've got a bit of stomach gas, but honestly, I'm okay with that. It's not too bothersome.
I totally understand, and I see you're also on metformin, 500 milligrams twice a day. Are you taking that regularly?
Yes, I am.
And you're taking glipizide 5 milligrams twice a day as well, correct?
Yes, that's right.
Do you take any other prescription medications?
No, just those.
Any non-prescription medications?
No, nothing like that.
Any herbal supplements?
Just a multivitamin for diabetes.
Got it. Do you smoke or drink alcohol?
No, I don't do either.
All right, Eric. Based on what you are describing, it sounds like you are experiencing symptoms of low blood sugar, which we refer to as hypoglycemia. This can happen because glucobay should be taken with the first bite of a main meal, and it's important to avoid taking it between meals. Acarbose, which is the active ingredient of glucobay, prevents other sugars from being quickly absorbed. When you have low blood sugar while on this medication, it's best to use glucose tablets or honey instead of sugar cane or candies.
Oh, I didn't know that.
No worries, Eric. I'm glad we are talking about it now. I'll offer you 15 grams of glucose tablets, and we'll test your blood sugar again after 15 minutes to see how you are doing. Remember the 15-15-15 rule? For treating low blood sugar, after taking 4 of 4-gram glucose tablets, wait 15 minutes and retest your blood glucose. If it's still low after repeating this twice, you should head to the emergency room.
Thanks for explaining that.
Of course. I also want to mention that taking metformin and glipizide along with glucobay can increase your risk for low blood sugar. I'll fax your doctor to discuss possibility of lowering your doses.
Okay, that sounds good.
Just a few more tips. Try not to skip any meals, and regular exercise is important too. It's crucial to consult your doctor if you make any lifestyle changes, since that can affect how your medication works. Keep monitoring your blood glucose levels regularly. Also, please remember to get your vaccinations updated and avoid driving right after experiencing hypoglycemia. It might also be a good idea to wear a medical alert bracelet or some form of identification for your diabetes, especially if you don't always recognize the early signs of low blood sugar.
Thank you so much, Luna. I really appreciate your help.
No problem at all, Eric. We'll give you a call as soon as we hear back from your doctor and to check in on how you're doing. Take care of yourself.